Hello. I know having a joint replacement is a big deal, and you may have lots of questions. I truly want you to have the best care and best recovery possible, so I put together this presentation to help guide you through the experience. In the slides that follow, you will find helpful information about what you can expect during every aspect of this journey. You may review these anytime, and always know that I'm here to help. Joint replacement really is a team effort, and it is so important that you have good support during your recovery. No matter the surgery, for a safe discharge to home, you must have someone willing to stay with you while you recover. I call this person a care coach, and I encourage you to have this person view these materials and accompany you to your visits. Let's begin by discussing important topics to consider before your surgery. Your journey begins long before the day of surgery, and thoughtful preparation will give you the best chance for a successful outcome. It is important to prepare yourself physically and mentally. Before surgery, I may ask you to do some things to improve your health prior to surgery. This is all in an effort to reduce the risks associated with common conditions, including obesity, diabetes, anemia, or smoking. Smoking or nicotine use doubles the risk of infection after surgery, and therefore it is mandatory for all my patients to stop smoking for at least 1 month prior to getting a surgery date. You may have heard the expression, "you are what you eat." Now more than ever, you need to fill your body with nutrients so that it can properly heal after surgery. Don't wait until after surgery to change your diet. It'll be too late then. Please look over the nutritional guidelines I gave you in clinic and make necessary dietary changes now if you need to. I often get asked about supplements. While nothing can take the place of a healthy diet, I think some of these supplements may be of benefit. The first one is vitamin D. Did you know that approximately 40% of American adults are vitamin D deficient? I recommend starting a daily calcium and vitamin D supplement starting today. The second one is vitamin C. Recent studies have suggested that vitamin C may be effective in reducing post-operative inflammation and blood loss. The dosage that has been studied is 1 gram a day starting after surgery. The next is essential amino acids. Multiple high-quality studies have shown that essential amino acid supplementation can aid in restoring quadriceps strength and muscle volume after joint replacement. Various brands and formulations are available, but Mend offers a well-researched medical-grade option. You should have received a handout about this in clinic. If not, just go on their website, mend.me, and you can order from there. For optimal results, you should start supplementation 1 week before surgery and continue for 2 weeks post-operatively. Finally, bioflavonoids, in particular diosmin, has been recently shown to reduce swelling and pain after joint replacement surgery. The second thing you are going to need is a walker. My clinic can provide you with a prescription to have one delivered to your home if you would like. Now, some of you may already have a walker or have your friend's walker. Whatever the case, it is important that it is a 2-wheeled walker, not 4-wheeled, and not a rollator, as those are not as safe. The other thing you are going to need is a cane, which you can pick up from Walmart or your local drugstore. Next up are these edema wear compression stockings. We are currently in the process of stocking these in our clinic to make it easier for you to obtain. But until then, I strongly recommend that you go online to the link listed here, edemaware.com/order here to buy them. Now, when you get to the website, you should scroll all the way down to the bottom where it says edemaware shaped stockinettes, cone shaped, size small, and those are going to be the ones you want to order. These stockinettes are going to help reduce swelling and pain after surgery, and they are so much more comfortable and breathable than anything else that I know of on the market. I recommend buying 2 so you can change them daily. I want you to have a way to track your steps after surgery. You can use a pedometer, a smartwatch, or simply download a step tracking app on your phone. Whatever is easiest for you. This will be an important part of your recovery. First, it helps you see your progress over time. Second, it allows you to make sure you don't exceed the recommended number of steps each day. Your post-operative recovery guide will include the daily step limits I want you to follow, and having a way to monitor your steps will help you stay within those goals. Finally, here are some additional supplies that are optional, but some patients have found to be useful. They are a raised toilet seat, a shower chair, a pill organizer, and a foam leg elevator. All of these are available without a prescription. It is important to keep active to the best of your ability and within your physical limitations. Prior to surgery, I would like for you to see one of our physical therapists for a pre-op evaluation. You'll have a much easier time with recovery if you learn how to use a walker and cane ahead of time and how to do the exercises ahead of time rather than trying to figure it out after surgery. I recommend bringing your coach with you to this appointment. Prior to surgery, you will receive a couple things to help reduce the risk of infection. The first is mupirocin ointment, which you should apply to your nostrils twice a day for 5 days prior to surgery. The second is Hib Cleanse soap, and I would like for you to use this the night before and the morning of surgery. Some patients have kept using this soap after surgery, but I don't recommend this as it can dry out your skin if used too often. Historically, all patients were admitted to the hospital after joint replacement surgery. However, with advances in surgical techniques and pain control, most of my patients can safely go home on the day of surgery. There are many benefits to same-day surgery, including lower complications and improved satisfaction. However, outpatient surgery is not for everyone. If you are unsure about going home the same day, please discuss this with me prior to surgery so we can come up with a plan for you. Regardless of whether or not you plan on staying the night, here is a list of typical items to bring for your procedure. You should expect a call the day before with your surgery time and arrival time. Typically, we ask patients to arrive between 1 and 2 hours prior to surgery. This allows for check-in and any preoperative testing or procedures. If you arrive late, your surgery may need to be postponed or rescheduled. The night before surgery, you cannot have anything to eat after midnight. In the morning, you may have clear liquids for up to 2 hours prior to your arrival time. This includes water, Gatorade, tea, or black coffee. I know it may be hard, but try to get a good night's rest. Now let's talk about what happens on the day of surgery. On the day of surgery, you're going to check in at the front desk. From there, you will be brought back to the pre-op holding area, where you will meet with your anesthesia provider, me, and some of the OR staff who will be helping take care of you. We will go over everything one last time. I will confirm and mark your surgical site, and then we will be off to the OR. Surgery typically takes me 1 to 2 hours. I will call your care coach to give them an update when we are done. After surgery, you will be brought back to our post-anesthesia care unit for another 1 to 2 hours to recover. Once you are awake from anesthesia, we will get you up and moving with physical therapy. During your physical therapy session, the therapist will work with you to ensure appropriate mobility and activity goals. Please pay close attention to their instructions and don't hesitate to ask them any questions if you are unsure. A question I get asked often is about stairs. If you have to navigate stairs to get into your home, the therapist will 100% ensure you can do them safely before we let you go home. Most patients are discharged on the day of surgery. The criteria to go home are the 3 Ps: pain controlled, pass PT, and able to pee on your own. In very select cases, due to increased medical or therapy needs, patients may require discharge to a nursing home or rehab facility. However, I strongly discourage this unless absolutely necessary, because it is associated with poorer outcomes following joint replacement. We will now discuss what happens after surgery. Our joint coordinators will have home health physical therapy set up for you once you go home. Usually, they will come to your house a couple times a week for the first 2 to 3 weeks. Depending on your progress and preference, I may provide you with a script for outpatient physical therapy once home health physical therapy finishes up. Falls can result in serious harm after surgery, resulting in wound complications, tendon/ligament injuries, or fractures. Please use caution and follow instructions from your treatment team to reduce your risk of falling. While pain control is a priority, it is important to have realistic expectations following surgery. Everyone has different pain tolerances, and there are variables that can affect your pain, such as prior use of narcotic pain medication. At your preoperative visit, we will go over your personalized plan for pain control. This typically includes several medications, each working differently, but together to improve your pain after surgery. We will discuss how each one works and go over a schedule on when to take them. Most patients who follow this plan are able to get through their joint replacement recovery with minimal to no narcotics. With regard to your surgical dressing, most of the time it requires very little care. As long as there is no visible drainage on the dressing and no water gets underneath it, it can stay in place until I see you back at the 2-week follow-up visit. However, if you have any concerns about it at all, please do not hesitate to contact my office. Swelling is an unavoidable part of the healing process, but can be painful and affect your progress. The more swelling you have, the more pain, and the less range of motion you will have. The therapy protocol I use has been proven to reduce swelling, so please follow it. This is from the study that my protocol is based off of. The top line is data from a well-respected joint replacement center in the US. The bottom line is from patients who follow the protocol. As you can see, there's a significant reduction in swelling by following this protocol, and with that, improvements in pain relief and range of motion. So, what is the protocol? Well, we already covered some of it, which is pre-op education, so thank you for watching this video and being an informed patient. Pre-op optimization of making healthy lifestyle and dietary changes ahead of time is also important. During surgery, there are a couple things I do involving minimally invasive surgical technique, and then the rest is really up to you after surgery. After surgery, I want you to limit the number of steps you take each day. Think about it this way. If you sprained your ankle, would you walk more to help it heal faster, or would you rest and ice it? The same logic applies to your knee replacement. The exact number of steps that I want you to limit yourself to will be in your post-op recovery guide. The PT protocol I want you to follow will also be in this booklet. It's going to involve a lot of rest and elevation and range of motion exercises, but not much else, which may be a little different than what other patients may go through. The other parts of the protocol are wearing the Edema-Wear compression stockings almost 24/7, except for hygiene purposes, using the ice machine 30 to 40 minutes every hour that you are awake, and following the post-op medication regimen. I find that most patients who follow the protocol really don't end up taking a lot of narcotics for pain, which is great because they have all kinds of side effects. Recovery is a little different for everyone. In general, the first couple of weeks tend to be the toughest. By 6 weeks, most patients have full range of motion of their knee and are able to resume normal activities. However, if you work a physically demanding, on your feet all day type of job, I recommend holding off on returning to work for 3 months, as doing too much early on may lead to increased swelling and subsequent pain. I also want to add that many patients experience difficulty sleeping for the first 3 months, but it tends to get better after that. Sleep aids like melatonin may help. At some point, you may notice a difference between doing well and feeling well. What I mean by that is you might be meeting all your recovery goals. Your pain is under control and your range of motion is great, but your knee still doesn't quite feel like your own. It may still act up if you overdo it. That's completely normal and part of the healing process. Improvement continues gradually for up to a year after surgery, and some studies even show progress for as long as 2 years. Finally, I want to go over some precautions and contact info. Some degree of discomfort and funny feelings are normal following joint replacement, but others may be sign of something more serious. Please let me know if you experience any of the following: fever greater than 101, excessive leakage of fluid of any type or color from the incision, uncontrollable pain despite interventions, numbness or weakness in the arms, hands, legs, or feet, persistent nausea, vomiting, or recurring headaches. There are many ways to get in touch after surgery. Our nurse navigator is available by phone to answer any questions. You may also call the main office number or send a MyChart message. If you have an urgent question, please call the nurse navigator or the main office. MyChart message should be reserved for non-urgent questions. It is important to remember that almost all questions or concerns can be resolved without going to an emergency room, so please call me before going to the ED. You may find that, from time to time, you will be asked to complete various questionnaires about your joint replacement. In addition to seeing how you are doing, this information can be used to better understand how to improve joint replacement surgery for others. Thank you for watching this video. Please feel free to review these slides at any time. I encourage any questions or comments so that we may make your experience as comfortable as possible and improve the quality of these materials for future patients.